This video will discuss the caudal brachial muscles. Hello everyone, this is Shireen Hafiz and let's get oriented first. So this is dorsal, this is ventral, this is cranial, and this is caudal. And we're going to start the discussion with the triceps brachii, big one that, as the name implies, should have 3 heads. But guess what? In the dog, it has 4 heads. So let's start with the lateral head of the triceps. It can be only seen from the lateral side. So this is your lateral head of triceps. Then we have the long head of triceps. The long head of triceps can be seen from both the medial and lateral side. So I'm going to flip to the other side. Here is still, that's your long head of the triceps. Okay. And then since I am on the medial side now, I can see the medial head of the triceps. So this is medial, and we already mentioned lateral, and we already mentioned long. What is number 4? So number 4 is the accessory head. I will go back again to the lateral side, okay, and I will reflect the lateral head of the triceps, and when I do that, I see the accessory head of the triceps. So basically, the lateral head, you see it only from the lateral side, the medial head only from the medial side, the long head from both sides, and you see the accessory when you reflect the lateral head. The long head of the triceps attaches on the caudal border of the scapula. That's one attachment. The lateral head, the medial head, and the accessory head all attach on the proximal humerus. They do not attach on the scapula, meaning the long head is the only one that attaches on the scapula. All 4 heads insert on the olecranon. So because of the attachment, there is a little bit difference in action of these heads of the triceps. All heads of the triceps extend the elbow joint. It is a major extensor of the elbow joint. The triceps is a major extensor of the elbow joint. But in addition of extension of the elbow, because of the attachment of the long head on the scapula, it also flexes the shoulder joint in addition to extension of the elbow joint. The triceps is innervated by the radial nerve, and in a matter of fact, if I reflect the lateral head of the triceps, I can see the radial nerve, and here is dividing into your superficial branch and deep branch. Okay. Then I will go on the medial side, and here is your radial nerve going to the triceps. Okay, so triceps. The next muscle we're going to discuss is your tensor fascia antibrachii. So we are on the medial side. Again, for your orientation, here is caudal, and here is cranial, and here is dorsal, and here is ventral, and this is your latissimus dorsi. So here it is your tensor fascia antibrachii. The tensor fascia antibrachii has an attachment on the fascia of the latissimus dorsi, and the other attachment on the olecranon of the ulna. Tensor fascia antibrachii also an extensor of the elbow, and it's also innervated by the radial nerve. Then the next muscle that we're going to discuss is Anconeus. We have to go to the lateral side, And again, we're going back to our lateral head of triceps. We're going to reflect it. And here we go. We find the Anconeus. The Anconeus is also an extensor of the elbow joint, and it's innervated by the radial nerve. So pretty much all muscles that we discussed in this video, the caudal brachial muscles, are all innervated by the radial nerve. See you in the next video.